How long should you wait to see a fertility specialist? This is a complicated question depending on who you ask. I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. There's some guidelines that we follow, obviously, based on your age, but this is also a personal question based on how big of a family you want and how much answers you want. So I would say part of this is dependent on you and where you live and how much access you have to a fertility specialist, but I certainly wouldn't wait more than 6 months to 12 months if you're trying to conceive. And that's the longest I would say you want to wait. First, you look for some red flags. I think some of the red flags you want to pay attention to are your menstrual cycles. People underestimate how important menstrual cycles are. Are you cycling every month? Are you cycling with normal flow? Do you have spotting in between your menstrual cycles? Those are really important things to pay attention to. You can track it on a calendar. You can use ovulation predictor kits to see if you actually do ovulate. Those are useful tools that you can buy from the supermarket. You can buy them online. More and more people are using Oura rings. I have one myself. You can also use apps, download them, or purchase hormone kits online. Your menstrual cycle is an important vital sign that helps you know if you have any issues going on. If you're not having your period or if they're irregular, you definitely want to start talking to your doctor, whether it's your primary care doctor or your OBGYN. It could indicate a hormonal imbalance either related to fertility hormones such as LH, progesterone, or it could indicate something more significant. Maybe there's a thyroid disorder or another hormone called prolactin that's released from the brain. These are important things that can be tested easily and get to the bottom of what might be going on. The other thing you want to think about is how long do you go before you see a fertility specialist? Say your periods are normal, you're cycling every 28 to 30 days, you're using ovulation predictor kits, you get a positive on your ovulation predictor kits month after month, but you're not getting pregnant. So there's different timelines that we recommend. Typically we say if you're younger than 35, you want to give it about a year before you seek medical attention. If you're older than 35, you want to give it 6 months. I think these guidelines are there for general population, but as an individual, you want to think about how many children you want to have. If you're starting later in life and you want to have, say, a bigger family, you might not want to wait a full year, even if you're, say, 30. Because if you're starting at 30, by the time you get pregnant, give birth, and recover, you already have lost a couple years. And in fact, the American College of OBGYN recently recommended 18 months between pregnancies. And people are starting to have families quicker. They're having children back to back. So even though we're having children more quickly, once we start our families, women are still aging in that interim, and your ovaries are definitely getting older, and ovarian aging is one of the most important predictors of your fertility. So if you're having trouble getting pregnant when you're younger, we certainly are going to be worried with adding age to the equation, okay? So definitely think about how many children you want to have, and don't wait longer than the recommended guidelines, but certainly you could consider doing some evaluation sooner than that as well. The last thing to think about is what is the difference between an OBGYN and a reproductive endocrinologist? A lot of people don't understand that they aren't the same thing. So an OBGYN, obstetrics and gynecologist, is a doctor who finishes their medical school training and then spends another 4 years in what's called residency, training to be an obstetrician and gynecologist. Not all obstetricians and gynecologists practice both obstetrics and gynecology. Obstetrics is a field where you're delivering babies and managing pregnancies. Gynecology is generally taking care of other reproductive issues in women. So it might be when you go get your pap smear, or when you have gynecologic issues, for instance, your menstrual cycle being managed, or for instance, birth control pills. Most of the time, the same doctor is handling both of those, the pregnancy and your regular routine gynecologic problems. Sometimes an obstetrician gynecologist might only practice one side or the other of that specialty. A reproductive endocrinologist completes their obstetrics gynecology training in residency and then spends an additional 2 to 3 years, depending on when they trained. During my time, it was 3 years, doing what's called a fellowship. So after residency, we spend some more time doing specific training in fertility and reproductive endocrinology. So during that time, we'll do in vitro fertilization training, learning how to retrieve eggs, do embryo transfers, but we also spend a lot of time learning about hormones. And so we become super specialized in hormones related to the reproductive system. The pituitary is a part of the brain that actually releases these hormones that communicate with the ovaries. So those hormones include LH, or luteinizing hormone, and FSH, follicle stimulating hormone. So we're specialists in understanding the hormones that affect and control the ovaries. The ovaries release estrogen and progesterone, and so there's an interplay between between these hormones, and we learn a lot about this and the menstrual cycle. And that's really important when we're managing your cycles for in vitro fertilization, or if you're doing intrauterine insemination, or if you're having problems with your menstrual cycles kind of at a higher level than your obstetrician and gynecologist who's trained generally, meaning they haven't done a subspecialty fellowship training in reproductive endocrinology, might be able to manage. So if you don't have periods at all, for instance, if you've never had a period, or if you stop having periods, you might have a condition like polycystic ovary syndrome, which some general gynecologists are comfortable managing and others aren't, but these are areas that we are particularly good at managing. So in terms of how long you should wait to see a fertility specialist, it's really going to depend on many factors. Some of them depend on the symptoms you're having, how big of a family you want to have, and it also depends on the region that you live. In some areas you have an abundance of reproductive endocrinologists, and other areas you don't. In some areas, the obstetrician and gynecologist is very comfortable and skilled at managing fertility problems, and there may be a shortage of fertility specialists, and in fact, we're seeing that more and more. So it really depends on those particular factors and your comfort. These are decisions you'll have to make for yourself, but I wouldn't be discouraged, and if you see someone and you feel like you're not getting the answers you want, then you definitely should get a second opinion and reach out to your local reproductive endocrinologist. That's what we're here for.